Okay, so what I'm interested in, as many of you know already, and I'm quite sure many of you heard me talk before, so forgive me if I'm repeating myself again, but I'm interested in primarily in the energy issue. That's who I am. Okay, now the key point to remember about fatigue syndromes, ME, long COVID, is that they are clinical pictures. They're not, I don't see them as a diagnosis, because a diagnosis implies a mechanism. And what we're interested in, of course, are what are the underlying mechanisms that are causing these clinical pictures, because that has obvious implications for management. And in people who have pure chronic fatigue syndrome, that's characterized by poor energy delivery mechanisms. And ME is the poor energy delivery mechanisms plus inflammation. I'm going to do, now you've heard a lot about the inflammatory side of things. I'm going to talk about energy delivery mechanisms, and have to say that's the easy bit. The easy bit is improving energy supply in the body. The difficult bit is reprogramming and working out where all this inflammation is coming from. So let's do the easy stuff. And the point here is I'm sure this is the case for many practitioners, all my patients are poor. They can't work, very often they're surviving on benefits. And so the tools, the trade that I love to use are those that are available to everybody and relatively inexpensive. So the point is everybody can do these interventions. Okay, so this is a symptom that everybody presents with, and I use the Mr. McCorber analogy here. But the point here is that energy, we have a certain amount of energy available to us in the body, and we cannot overspend that. If you overspend that energy, you will die. And therefore, to stop us overspending energy, then we get given very nasty symptoms. This is one of the first characters who did spend too much energy. He ran to announce the victory at the marathon and gasped his message out and then promptly dropped dead. I don't recommend that. That's called graded exercise therapy, in case anybody's unaware of what this means in modern terms. So I've just said, I'm terrible at jumping ahead of myself, but as I say, the point here is that we cannot go into negative exercise because it kills us. And to stop the body from doing that, the brain and the body has to give us symptoms, and it has to give us very nasty symptoms, because if they're not very nasty symptoms, then we will go on spending energy. So listen to those symptoms. They are the warning signs. You ignore them at your peril, because they are obviously the red flags that tell us there's impending pathology. And one of the problems of modern medicine is so much is directed at symptom suppression with drugs. And that's short-term gain, long-term pain, because the underlying pathology runs on regardless. Okay, so that's the book about it. Okay, so, and of course, fatigue is the worst, the commonest symptom. When I was in medical practice in the 1980s, fatigue accounted for 40% of all GP consultations. Now people don't bother to go and consult their GPs because they know they're not going to be very helpful. So you have to sort it out yourself. And we know how much energy we've got from symptoms. And I'm not going to go through all these because I'm quite sure that you're all capable of reading. But the difference between normal fatigue and pathological fatigue is the delayed factor. So, and at the start of treating people who have fatigue, any sort of fatigue syndrome, it's very important that activity is paced so that they're not getting that delayed fatigue. Because when you're getting delayed fatigue, that means tissue damage. Athletes suffer from this as well. It's called overtraining, and athletes who overtrain, actually their quality of their performance declines. I'm quite sure Steve Redgrave suffered from delayed fatigue after his gold medal winning performance, but he had to do that in order to achieve. But if you do it on a daily basis, that's major problems. So poor energy delivery to the body gives the symptom of fatigue. The brain. Brain fog, as you've heard, is a very, very common symptom. And much of that is due to poor energy delivery mechanisms to the brain, because although it weighs just 2% of body weight, it consumes 20% of fuel. It's vastly demanding of energy. I mean, it's essential to our success as a species and to our survival on the planet now, but we've got to look after it. We've got to make sure we get good energy delivery to the brain. And then the brain will give us symptoms in order to stop us spending energy. And my view is that many symptoms like depression, like anxiety, like feeling stressed, is how the brain makes us stop spending energy. And that feeling, a big part, and feeling stress is the symptom we get when the brain knows it doesn't have the energy that it needs to deal with demands. Okay, and of course that's reflected in our face, you know, and doctors look at people, and we all look at each other, and we can see how well somebody's feeling, because what's going on in the brain is reflected in our face. And if somebody is happy and jolly and smiling and extrovert, we know they've got lots of energy, and the converse of that is true. Another clue here is we start to use addictions to mask the energy differential. So, you know, people who don't have much energy, they will use caffeine, maybe amphetamine, maybe cocaine or ecstasy to mask that horrible symptom of fatigue. It's dangerous medicine to do that, but in the short term, it does mask the symptom. Or using addictions to calm us down when we're feeling stressed. And obvious things like nicotine, cannabis maybe, but the most, and alcohol obviously, but the most pernicious addiction and the most socially acceptable and the one that most people rely on is to sugars and junk food generally. Okay, so you can read all that. And those are symptoms when we've got good energy delivery mechanisms. Okay, so as I mentioned before, the first principle of depleted energy is don't overspend. Because when you overspend, you go into anaerobic metabolism and you produce lactic acid. And lactic acid is bad news for many reasons. First of all, it's painful. Secondly, it inhibits mitochondrial function directly. It'll make your mitos go slow, which is a bad thing. And it's very inefficient because of what's called the Cori cycle. If you burn energy anaerobically from one molecule of glucose, you will get 2 molecules of ATP. But to convert that lactate back to pyruvate requires 6 molecules of ATP. So it's like borrowing energy from a loan shark. It's a very bad deal. Again, it's very boring to pace, but in the early stages, pace you must. Okay, so this is the analogy I use all the time for my patients, because guess what? I get it and my patients get it. And I now know these interventions work reliably well. And the key point here is just like, you know, the body is an engine. Okay, it's a bit more complicated than the car, but the fundamentals are the same. And for our car to go, we need the right fuel in the tank, the engine to burn that fuel, the control mechanisms right, and then service and repair of our engines occurs during sleep. You know, my beaten out truck at home trots down to the garage every 6 months, but humans, we need sleep, and we need enough of it, and we need sufficient quality of sleep for the business of healing and repair. Okay, so the single most important intervention is to do a paleo ketogenic diet. And the logic behind this is simply that this is the diet that humans evolved. In fact, all mammals evolved consuming for hundreds of thousands, nay, millions of years. And I've just pulled out another book about it, but the point here is that mitochondria function best on ketones. That is the desirable fuel. And whilst we're talking about inflammation, ketones are one of the most anti-inflammatory substances within our body, so that will help damp down any inflammation that's there. And the most pro-inflammatory substance in the body is sugars. They are very dangerous to us. That's why we always burn sugars in preference to fats in order to get rid of those dangerous substances. So the diet is absolutely critical. And if anybody is listening to us talking today and you go home and you do nothing other than do the diet, that's the single most important intervention, in my view, for treating people with fatigue syndromes. It's also highly effective for athletes, and the endurance athletes, the middle distance athletes, the runners and the swimmers, they reckon to improve their performance between 7 and 15% simply by eating a ketogenic diet and fueling their body with ketones. There's Hippocrates again. And then we should all be taking a basic package of supplements. I was chatting with John earlier, flagged up the importance of selenium. Selenium is so important. I mean, I can't think of a mineral that isn't important. They're all vital. And the fact of the matter is that without supplements, we are all deficient, simply because our soils are becoming increasingly deficient in minerals because of modern farming techniques. And again, you know, make sure that you're consuming sufficient calories. I mean, so many people I see, their weight creeps up and they think they can control that by reducing the number of calories that they eat. But that simply starves them of fuel. And if you starve the body of fuel, it will simply shut down energy burning. And we all know people who are chronically underfed will have insufficient energy and insufficient fuel to power themselves. So work out how many calories you need. Again, protein intake is so important. And this was some lovely work based on 2 evolutionary biologists who asked, why is it that some people tend to get fat and some people tend to get thin? And what they discovered is that we have a particular appetite for protein, and we will go on eating food until that protein appetite has been satisfied. So they started work on insects, and they fed insects, low protein, normal protein, and high protein diets. And what they found is that those insects consuming a low protein diet continued to eat until their protein appetite was satisfied, and they all put on weight. Conversely, those eating a high protein diet, their protein appetite was satisfied, they ate less, and they all lost weight. So the paleo ketogenic diet is not an Atkins diet, it's not a high protein diet, it's a normal protein diet, and that can be calculated fairly easily. Again, fiber is so important. Fiber is essential for the large bowel microbiome, and it's the microbes in the large bowel that are largely responsible for programming our immune systems. And it has, again, that microbiome has profound anti-inflammatory effects. And some of you may be aware of the work, for example, of Thomas Borody in Melbourne in Australia, who uses fecal bacteria therapy to treat patients with fatigue syndromes. Study published, 60 people, 70% saw worthwhile improvements simply by upgrading their microbiome. There we go. So if you're not sure what your turds should look like, there is the Bristol stool chart. As I say to my patients, your number 2s should look like number 4s. So you can even get the t-shirt. I didn't. And again, fats and oils, they're just so important. We have been brought up with this fear of fat. High fat's going to cause high cholesterol, it's going to cause heart disease. Wrong, wrong, wrong. Fats are the safest and most desirable foods that we can consume. In fact, one example of that is that the contents of the gut are so toxic that that which is absorbed from the gut goes from the portal vein to the liver to be sorted out. But fat doesn't have to do that. Fat can go past directly into the lymphatic system, directly into the bloodstream, because it is so non-toxic. And it is a very desirable food, and of course, the raw material for making ketones. Again, saturated fats, I'm not going to read all this out because you can read, and many of you have heard it before, but saturated fats are the ideal fats that should be fueling our bodies. And again, you may think I'm maligning carbohydrates. Yes, they're essential foods. They're the raw material with which we make ATP, with which we make RNA, and which we make DNA, and also for detoxification, but we just have too much of them. We are awash with sugars and refined carbohydrates, and they are pro-inflammatory and making us ill. So we have to get, so the key is we have to do the diet. And people say, well, what can I eat and what can't I eat? And the answer is, you can eat whatever you like so long as you get into ketosis. And it's very important that you actually measure, because we are very good at fooling ourselves, especially when we're addicts. And believe you me, I'm a good addict too. So the way that you know that you've done the diet sufficiently well is to get into ketosis. And these are the various ways that you can measure ketones, either through breath tests or through blood tests or through urine tests. And then the next thing you have to do is tackle the upper fermenting gut. This is so important, because if you are overwhelming the upper gut with sugars and carbohydrates, then instead of being a sterile, carnivorous digesting gut, it becomes a fermenting gut. And that is bad news for all these reasons. Now, I'm not going to read them out because you're quite capable of reading and you would die from boredom, but it's pro-inflammatory. The toxins that come from the bacterial endotoxin that comes from those fermenters, the fungal mycotoxins, all have to be dealt with by the liver. Many of the products of fermentation inhibit mitochondria. Microbes themselves will spill over into the bloodstream and get stuck at distal sites. And I'm quite sure that a huge amount of pathology is driven by bacterial translocation. Yeast, bacteria, maybe even viruses getting from the gut into the bloodstream and getting stuck at distal sites. Examples of that, I think that, well, fibromyalgia is an obvious example. Many cases of arthritis we know due to molecular mimicry, mechanism the same. Inflammatory condition of arteries, polymyalgia rheumatica, temporal arteritis, venous ulcers, renal disease, brain pathologies. All these pathologies are linked to, are driven, I believe, by microbes from the upper fermenting gut. So sorting the diet out and the gut out is so, so important. And it does some good things as well, of course. And how do we treat the upper fermenting gut? Well, first of all, stop feeding them. So eat a low carbohydrate, low fermentable substrate diet. So starve them out, literally the PK diet. Normalize digestion, and the starting point to normalize digestion is to chew your food properly. Again, I could talk for at length about the importance of chewing food, but we've become a nation of soft food and gobblers, and that's not good for our gut. A mastic gum, just chewing that is very helpful. And then the other two interventions I love to use is vitamin C to bowel tolerance. And again, as we've heard, vitamin C is a very important anti-inflammatory. We're all short of vitamin C because we can't synthesize our own vitamin C from sugars, as can most other mammals. And my view is we need at least 6 to 8 grams daily of vitamin C, little and often through the day. And then last thing at night, Lugol's iodine. Again, iodine contacts all microbes at about 10 parts per million. It's a fantastic antiseptic, extremely safe. And both these, whoops-a-daisy, both these tools are inexpensive and multitask. They help us to detox, they're anti-inflammatory, they're important antioxidants. So, these are all cheap, simple interventions that we can all do. And at this point, you're now in a fit state to start to tackle the mitochondrial engine because you have a gut which can absorb. If you're taking lots of expensive supplements on a fermenting gut, then you're just feeding the fermenters and possibly making the fermenting gut worse and quite likely malabsorbing. So there's a certain order that we need to do these. And this is what your mitochondrial engine needs for it to function. And we learned much of this in the 1990s and the 2000s with John McLaren Howard, who should be awarded the Nobel Prize for Medicine, in my view, from the wonderful investigative tests and research that he's done. But he developed a test of mitochondrial function. And from that test, we were able to give an objective measure of how well people's mitochondria are working. And we published a study, we carried out between 2005 and 2008, and it was published in 2009. Where all these patients had 71 patients who'd had the basic workup that I knew to do, and then John did his mitochondrial function test. It was published in the Journal of Clinical and Experimental Medicine, and this is the most important graph that comes from that. And what this shows is that those people with the worst level of fatigue, and I assessed the patients clinically, the bloods then went down to I think it was Biolab then who did the tests, and John measured the activity of their mitochondria. And there was a straight line relationship between the two. So this tells us that the most severely afflicted patients have the worst mitochondrial function. We then asked the question, well, are these interventions going to be effective that we're putting in place? All the things we're talking about today. These were for individual patients, and we had 34 patients, and the first 30, in the yellow is the mitochondrial function, I beg your pardon, the purple is the mitochondrial function score before, and the yellow the mitochondrial function score after. And as you can see, all 30 patients who did the regimes improved their mitochondrial function, and there are 4 at the end who, for reasons best known to themselves, didn't put the regimes in place, and in all 4 cases, their mitochondrial function got worse. Now, this study was done pretty much blind because the laboratory didn't know the clinical well-being of the patient. So it was a fantastic result. And the point here is that these regimes do work reliably well. You don't need mitochondrial function tests in order to be able to recover. You just have to take a leap of faith and put in place these regimes, which are, first of all, to provide mitochondria with the right fuel in the tank, which we've talked about. Then the raw materials, and again, we measured these things, CoQ10, magnesium, vitamin B3. We measured those levels, and deficiencies were very common. And so again, you don't need to measure your levels. You just take that package of supplements, on a non-fermenting gut, so you will then absorb. And then some people have problems with their mitochondria because they're going slow. John developed mitochondrial translocated protein studies, so we could look at what it was that was inhibiting mitochondrial function, and I pulled out the commonest results, and you can see them. But as you can see, the commonest cause of poor mitochondrial function was lactic acid. These patients are not pacing well, and they're constantly trying to push themselves to their limit. And so you can see, there's a very clear biochemical reason why grade exercise is guaranteed to make people worse. Okay, so those were the toxins, and the different toxins demand different methods for getting rid of them. But another one of my favorite multitasking tools are Epsom salt baths. Inexpensive, anybody can do them. We know now that they pull toxins, or they reduce the toxic load of the body, and you also get a nice dose of magnesium and sulfate, which further helps to detox. And these are the, I've got data now from 30 patients who've done heating regimes. Far infrared sauning is excellent, sunbathing is excellent. If you can tolerate a traditional sauna, but many can't, excellent. Epsom salt baths. It doesn't matter what the heating regime is, the toxic load came down reliably well. Okay, I'm going to rush on because, and there are other ways that you can detoxify that I've detailed there. And as I say, you can see that the same old favorites coming up. Glutathione, we've talked about, vitamin C, vital, iodine, high fat diet, all these things reduce the toxic load on the body. And we know many toxins and the pesticides are pro-inflammatory and switch inflammation on. So to reduce our toxic load is essential. And arguably, you know, even all us well people should be doing this, because I've never seen a normal test, and a normal test would be no pesticides, you know, no toxins available that can be seen on fat biopsies or blood tests or whatever. So once the mitochondria have been sorted, and as I say, these regimes we know does that reliably well, then we sort out the control mechanisms with, as I call it, the adrenal gearbox and the thyroid accelerator pedal. And a very useful, easy tool to assess how well energy delivery mechanisms are working is core temperature. And this is the joke, of course. There's no point fixing the thyroid and the adrenal glands until you sorted the mitochondria out, because you're literally flogging a dead horse, because many of the mechanisms by which thyroid hormones and adrenal hormones manifest are via mitochondria. Okay, so now there are some symptoms that are peculiar to the thyroid. Obviously, poor energy delivery symptoms. But if you have any of these things, then think hypothyroidism. It's very common. We know it's about 10% of the normal population, although only about 1 to 2% are actually treated. And other endocrinologists, Kenneth Blanchard reckons probably as many as 30% of Westerners are probably underactive with the thyroid. And it causes fluid retention, poor fat burning. That's another useful clue. If you've got a patient or you've got somebody who's doing a ketogenic diet and can't get into fat burning and feel terrible and feel as if they're hypoglycemic, I call that ketogenic hypoglycemia, because we need thyroid hormones to fat burn. And if the thyroid is underactive, then you will fat burn with adrenaline instead, and adrenaline makes you feel terrible. Other thyroid clues: you need thyroid hormones for sleep disturbance, and many people with fatigue syndromes are owls. They go to bed, they don't drop off until late, they don't wake up naturally till late in the morning. That's another good clue that there are hormonal problems here. Okay, those are the sort of signs we get. There's poor energy delivery. Yes, again, POTS has been mentioned. If you've got poor energy delivery to the heart, then it cannot beat powerfully as a pump, and therefore you get low blood pressure. And so that very low blood pressure that I think Ziggy referred to earlier is because the energy delivery to the heart is so poor, it cannot beat powerfully, and the blood pressure drops precipitously. The body compensates by beating, the heart tries to beat faster. So if you have a patient who's got a fast resting heart rate and low blood pressure, that's typical of poor energy delivery to the heart. And of course, when they stand up, you increase cardiac output by about 20%. It's much harder work. So the blood pressure drops precipitously, the heart rate goes far too quickly. That's not sustainable either, and the patient will fall over or pass out unless you don't lie them down very quickly. So the bare minimum of testing for the thyroid is to make sure you're not thyrotoxic. And then a trial of natural desiccated thyroid, glandulars, whatever, is often very helpful. And the key here is to start low and go slow, because if you because for many reasons. First of all, thyroid hormones have quite a long half-life. Thyroxine has a half-life of some days in the body. So if you increase the dose too quickly, you can overshoot and overdose. Thyroid hormones are also responsible for the number of mitochondria. and it takes time for the numbers of mitochondria to build up. So I like to use thyroid hormones, but do start at low doses, build up the dose very slowly, and don't overshoot, because you'll end up rendering somebody thyrotoxic, which is completely undesirable. And then adrenal stress profile, again, that's a useful test that I often request, that looks at adrenal function. And this is a typical result. And it's showing us two things here. First of all, it's showing us adrenal fatigue because the cortisol level is very low. But when you get a flat diurnal rhythm like that, that again points to an underactive thyroid. That's another useful clue that you can get from the tests. That's how I treat adrenal fatigue. I know that I'm not as good at treating adrenal fatigue, or I don't know as much about that as I do know about the thyroid stuff. Adrenal fatigue is tricky to treat. Obviously, you have to look at the underlying stressor, but you can support the adrenals with maybe herbal preparations like ashwagandha or ginseng are often useful, or adrenal support like pregnenolone, DHEA. All these relatively inexpensive, and anybody can purchase these. So to improve energy delivery, you have to do it all, but you have to do it in the right order, as I touched upon earlier. It's no point taking lots of expensive supplements if you've got a fermenting gut, because you're simply going to feed the fermenters and waste those precious resources. So that's the order in which to do it, and I think that's it. Half an hour. Did I do it?